Good evening, everyone. Welcome to the first day of the third edition of the New Earth Summit, India's first integrative summit on solutions to our problems in health, food, farming, and the environment. I'm Sophie from the Earth Keepers Connect Goa, your host for this evening. I extend a warm welcome to our esteemed panelists and also on behalf of our summit convener, Darryl D'Souza, and our 10 Earth Keepers groups in India and overseas. We express our gratitude to you for taking time out from your busy schedules to be with us and to share your insights and experience so that all watching this live webinar and its recording may benefit from the science and wisdom of the holistic models being presented on this platform, which will help us all co-create a beautiful world. So our topic for today is the miracles of allopathic medicine. So let me start with introducing our panelists to the audience. Dr. Somnath Bhandary, who hails from Mangalore. He is a family physician with over 30 years of experience and has worked in many corporate hospitals in Goa, in casualty, CCU, and ICU. He presently works as a factory medical officer at Cipla, Varna in Goa. He also has his clinic in Zuari Nagar, where he practices in the evenings. And second panelist being Dr. Lalit Kumar Anande, who has an MBBS postgraduate in clinical research. He retired in Jan 2021 from the position of medical superintendent of Asia's largest TB hospital, having 1,200 beds and pulmonary TB patients. He was the administrative head for the rare thoracic surgical department, actively involved in pre- and post-operative care. Dr. Anande has served in various capacities in a number of pharmaceutical industries, carrying out clinical trials for various drug targets for diseases such as diabetes, hypertension, tuberculosis, hyperlipidemia, epilepsy, HIV, immunomodulators, etc., conforming to the GCP, GLP norms and ethical guidelines. In 2017, he was selected as Mumbai Heroes by Mumbai Mirror of the Times Group and was awarded by the Honorable Governor of Bihar an award for his philanthropic work in the field of tuberculosis in 2018. Dr. Anande was also a special guest in a national TV show called Ticking Time Bomb, Satyamev Jayate in 2014. And finally, our third panelist, Darryl D'Souza, who has been teaching people how to reverse chronic illnesses with integrated natural therapies for over 16 years. After his own journey of 14 years of illness that almost ended his life in 2004. His book, Become Healthy or Extinct, as well as his lectures, seminars, webinars, workshops, and residential retreats on mind, body, and spirit healing are sought out by individuals and organizations across the globe. Darryl was the secretary of the World United Doctors and Healers Association for 5 years, during which he curated and convened their annual continued medico-spiritual education conferences. Darryl is also an organic farmer, an environmentalist, a TEDx speaker, founder of Earth Keepers Connect, ambassador of Vegan Nation, convener of the New Earth Summit, and a speaker at the World Parliaments on Spirituality. So in the first hour of this webinar, our panelists will be giving their views on a couple of questions we have for them, which will be followed by Q&A session with the audience for the next hour. If you would like to receive a recorded video of this webinar, please subscribe to our YouTube channel, The New Earth Summit. As our panelists answer the questions, you may also type your own questions in the Q&A box below, and we will take them up at 7 o'clock. So now I'll put forward our questions to the panelists. Dr. Bhandary, if you could share with us in 15 minutes, which aspects of the allopathic medicine do you feel are effective? Would it be allopathic pills for chronic illnesses, or emergency trauma medicine, antibiotics, intravenous supplements or oral supplements, intravenous medicine, diagnostics, surgery, radiotherapy, or any other treatment system that you practice? If you can go ahead, Dr. Bhandary.
Good evening, Dr. Anande, Mr. Darryl and the team.
Good evening.
I was asked to talk on allopathy. Allopathy is a big ocean. So for me, it's difficult to talk in 15 minutes, but I only touch upon few points of my experiences to you all. First of all, we study allopathy, the basics, anatomy, physiology, and biochemistry for 1.5 years. So most of all of the allopathy doctors are very thorough in the anatomy, that is the body structure, physiology, the functioning, or the metabolism, biochemistry of the body. Next comes the investigation, be it a small, simple blood test, urine test, a sputum test, or a non-invasive ECG, which will reveal many things about the diseases inside. Or the complicated diagnostics of scanning, MRI, CT scan, ultrasound scanning, or you know about all the complicated or the latest tests, RT-PCRs, everybody know about. This is the beauty of allopathy. Going back to the test, you all heard about a capsule endoscopy. You ingest a small capsule orally, and it will come out the next day probably, and you analyze the entire thing from oral cavity to the other end in your computer. That is the beauty of allopathy. A 95-year-old man getting admitted in the hospital, having replaced his entire knee, walking out of the hospital within next few days, it's definitely a miracle of allopathy. Or for that matter, poisoning, say about snake poisoning. Can you imagine a world without anti-snake venom? That too, a single injection will treat all the snakes poisonous snakes we know. Can you imagine other poisonings also? Or an acute MI, as you all know, severe anti-wall MI. A patient collapsed, unconscious, brought to the hospital, diagnosed, taken to the cath lab with a small cut on his groin. Angiography is done, diagnose the block, angioplasty is done, opening the block, and he is out of the hospital within a week, with almost normal cardiac functioning. It is the miracle. Or for that matter, complicated surgeries like kidney transplant, liver transplant, eye transplant, cornea transplant. You must have heard about the famous actor who died, Puneeth Rajkumar. He has donated his cornea for 4 patients. Now 4 people can see. They have got their vision back, or maybe vision for the first time. It is the miracle of allopathy. Or the major surgeries, like you have lost a limb or a finger or any membrane of the body, replaced with plastic surgery. Maybe the surgeries will take 24 hours or more than that at times. It is the miracle of allopathy. So, plus life-saving antibiotics. You diagnose a disease, infuse proper antibiotics, get the patient out of risk and discharge him. This is the beauty or the miracle of allopathy. Even many other surgeries, bypass surgeries, what we call it CABG, or major abdominal surgeries, or a simple surgery for that matter, repairing of cleft palate, cleft lip, thyroid surgeries, appendicectomy, or hernia, strangulated hernia, obstructed hernia, hydrocele, the repairing it and the patient get back to 100% normal activity is definitely a miracle of allopathy. Apart from that, latest keyhole surgeries, endoscopic surgeries, keyhole surgeries, robotic surgeries, even brain surgeries, heart transplant, lung transplant, our sir will explain more about it, are definitely miracles of surgery. I mean, miracles of allopathy.
Thank you, Dr. Bhandary, for giving us your views on the topic. We'll now be moving on to the second panelist, which is Dr. Lalit Kumar Anande. If you could please share your views on which aspects of allopathic medicine you feel are effective and also those that you practice.
Good evening all. Myself, Dr. Lalit Kumar Anande. 3 decades back, I started walking on a poor man's path. And I worked in a disease called pulmonary tuberculosis. This is basically, by and large, 3-4 decades back, was a poor man's disease. Having worked in a hospital, which is 1,200 bedded hospital. And that too, I selected deliberately to work in the surgical side because there were no doctors out there. As resident doctors, the housemen and all those people who are there are basically MBBS. And I selected that branch because nobody was ready to work in that branch. There was a shortage of doctors. I walked on that path because I knew this would make some unique difference. And having seen live lungs for the last 30 odd years, I mean, comparing it, the X-rays with the CT scans with the live lungs, feeling them with the fingers while they were operating, post-op managements, critical patients, all those things that happened in tuberculosis, pulmonary tuberculosis. It was like getting a clarity of what you see in an X-ray, what is there inside. And over a period of time, seeing the extensive drug resistance which was happening in tuberculosis. And in spite of taking medicines, patients failing the therapy, mainly because they were not taking the therapy as prescribed, simply because they do not like. People do like to take, it's not like, but they do follow anti-diabetic treatment and anti-hypertensive medicines, they do take. But when it comes to TB treatment, fault on all these things. Plus, it went on graduating over a period of time in the last 3 decades and has come out with some wonderful names, dangerous names. The mutations which happened from a simple TB bacilli to something called MDR, multiple drug resistant, to XDR, extreme drug resistant, to XDR, extreme drug resistant. Thereafter, somewhere around in 2012, we started hearing total drug resistance, means resistant to all the 13 odd drugs which were meant to be given in TB. And later on, we heard about some different mutations happening, Beijing strain coming into the play and all those kind of things. The disasters happening in the lungs and how to tackle those things. We were failing the war. Of course, the government has taken it over very seriously. And there's a program for all these things. But somehow I started understanding that the 2 different aspects of this treatment have never been tackled, have never been given importance. One is the surgical side of the treatment part of all these things. Means In the lungs, there are so many complications happening, right from a simple fluid happening in the lungs called pleural effusion to pus collections in the lungs called empymas, hydropneumothorax, pneumothorax, and so many of the complications which is not tackled completely. And that's where I concentrated on the surgical aspects of thoracic pulmonary tuberculosis, how to very quickly give the benefit to the patient. For example, I will tell you, patients present themselves with something called cavitations in the lungs. And what I saw over a period of time, 3 long decades, a cavity left unattended in the lungs later on gives rise to more drug resistance. In spite of the patient taking all the required drugs which he is sensitive to, in spite of that, more drug resistance forms. The book picture treatment of this cavity left unattended is dangerous. I mean, the treatment itself, you have to remove that part of the lung called lobectomy or something like that. We have done so many pneumectomies. The lungs, one of the lungs has been removed completely. So this was a book picture treatment. But then it's a big major surgery. Not many surgeons are there. Not many trained surgeons are there to do all this thoracic surgery in TB patients. In cancer, you can definitely find many. But when it boils down to tuberculosis, where the lungs are mashed up totally, it's a very difficult surgery. And in such kind of situations, what to do? What can we do? What are we missing in the entire line of treatment? Why all these things are happening? The failures are happening, the resistance are happening. There comes a new kind of things. Not new, it was already known. When antibiotics per se were not there in the market, post World War II, the antibiotics started flowing in. What was the line of treatment? What they were doing at that time? It was simple immunity, what they were tackling. The crashes of immunity, which has to be boosted up by way of diet. The dieting is a very big messy thing. In a pulmonary TB patient, he doesn't eat at all. His diet is completely, appetite is completely crashed. What to do in such kind of situations? So trying to do something here and there, some kind of research, some failure, some successes, some knowledge started popping up. And the word called antioxidants, I started using in a very, very large way. As a medical line of treatment, the surgical was there already, but not to take the patient to that level where the surgical surgery is required in the first place. Because the thoracic surgery is a left out branch for TB at least. There are not many surgeons out here in India. I was lucky that we could actually take up that thoracic surgery in TB hospital in a big time way, having surgeons who were 70 and 80 plus doing the surgery for the patients, for the sake of the patients coming over there. But anyhow, the thing is that the antioxidant treatment, what I started off with, came out to be a big time success. Started identifying which of the slow acting antioxidants the patient had a world of time to take it orally. But then there were so many patients who were very seriously ill, maybe dying, maybe in a week or two or something like that. The fast acting antioxidants, which are there, which has been documented for the last 80 long years, quite sufficient. Giving those fast acting antioxidants to the patients found brilliant effects in this thing, in reviving the patient back in this world of tuberculosis. Forget about tuberculosis, that works in so many other conditions. But my forte of working is in TB. So I just concentrated on that and I'm getting success. Right now, I've left that hospital because I retired from there and practicing in Mumbai, Navi Mumbai. Thank you.
Okay, so I was going to pose the same question to Darryl D'Souza. Which aspects of allopathic medicine do you feel are effective?
Thank you, Sophie. I will first speak of the good aspects of allopathy that I've experienced in my life. And I will give it from the perspective of being the secretary of the World United Doctors and Healers Association for 5 years, and that was till 2017, where we were integrating the best of modern medicine with the best of complementary medicine, alternative medicine, and the ancient healing sciences, wherein I interacted with over 1,000, great doctors, biologists, microbiologists, surgeons, healers, therapists, natural medicine men, shamans, and psychic healers as well. And this was the time when mainly I was convening the continued medico spiritual education conferences, which still remain the benchmark in this country for integrated mind, body, and spirit healing. So when I got pneumonia in 1990, it was so serious. I was coughing blood and I could not breathe, and I almost died of it. And it was so bad that the doctor came and saw me at night at about 10:15, and he told my mother that this boy is not going to survive unless I do something. And he went back to his hospital and he came back with steroids, some injections, and he injected me. And that's how I was, still alive in the morning. So that kind of pneumonia is something like what we are calling the COVID symptoms today. So I remember him giving me a course of antibiotics, whether it was 15 or 20 days, and that saved my life. So after that, and one thing at that time which I know today, he never advised us, or maybe he didn't know about it, that after a course of antibiotics, like doctors are advising us today, I think since the last decade, they are advising us to have probiotics, because antibiotics do kill off a good of your gut of bacteria. And if you do not replenish it with probiotics, your gut health is going to go down. So he didn't know about it probably that time. He didn't advise me. So, things went on. And after a few years again, I got sick by, drinking mountain water. And then I got fever. I had loose motions, and after some days, blood in my stools. Again, I ran to the allopathic doctor who gave me antibiotics again, and that saved my condition. But again, for the second time, there was no advice on this thing called probiotics, and this was somewhere 1993, 94. So with all of this, and I was working as a project engineer, working on sites and going around the country, eating food at dhabas and drinking, tap water. My gut system never got cured, and I landed up with amoebic, dysentery, which got worsened, and it became amoebic colitis. So I had a systemic disease in my small intestines and my colon. And I would often get the course of antibiotics from the doctors, but even then, never the probiotics after that. So this got my body getting worse. Then I suffered from first-degree piles, second-degree piles, and third-degree piles till the time I could not even sit on a chair, with the fear that anytime, the anal pouches of the piles would burst and I would bleed to death. And that's when, surgery saved my life. So uh, with that condition, I got even further, my health started dipping further, and I had fungal growth in my intestines, and then I started having skin allergies. They were so bad that I would really scratch off my skin. And again, allopathic medicines, like allergy medicine, that helped me survive at that time. But my life was so bad that I couldn't even eat food or wear footwear. And my condition was so bad that I was dying in 2004, because even intravenous antibiotics at that time could not save my life. But then I came across integrative natural medicine, and the 14 years of sickness I was able to reverse with just 1 year of integrative natural medicine, which I will talk a little bit about now. So I appreciate antibiotics, but only in acute scenarios and not as regular medicine that people will pop all the time and have their gut, their entire microbiome destroyed. I appreciate modern diagnostic machines because I used to have endoscopies and colonoscopies, which would tell, the condition of my intestines. At that time, we didn't have the pill what Dr. Bhandary mentioned that does, the entire recording of the entire digestive tract. I, of course, have to appreciate emergency surgery, which was done for my piles. And even in 2011, when I had a very serious machine accident with a machine saw that, cut off most of my wrist and only this much was left. And it took 4 reconstructive surgeries to restore my hand to good function. I appreciate intravenous supplements in very acute conditions, like some people are getting now high doses of intravenous vitamin C for these COVID symptoms. But I am completely against allopathic pills for treating chronic illnesses like high BP, cholesterol, diabetes, thyroid, arthritis, obesity, acidity, fatty liver, gout, constipation, migraine, asthma, sinusitis, heart disease, kidney disease, lung disease, hormonal imbalance, infertility, simple things such as backaches also, and chronic fatigue, and so-called many autoimmune diseases. Simply because they do not cure the disease. I just call them, a life support system. So I don't call those things medicine, because medicine is something that actually reverses your condition or cures you. So I just want to talk about a little bit about the history of how we landed here with so many people, popping these pills every day of their lives. So the history is in the 1900s, a group of businessmen led by John D. Rockefeller. Well, people were getting sick, but not as they're getting sick today. Few kind of illnesses like, probably acidity, headaches, digestive disorders, body aches and pains, cough, cold, a little bit of immune system dysfunction, tumors used to be there. So this group of people decided to make a business out of healing people. But their first problem was, how will these people leave their traditional systems, like, systems like Ayurveda, and every country has got its own natural medicine system. So herbal systems, acupressure, acupuncture, yoga, breath work, body work, or sound music, therapy, and all of that. So the formula was to make very cheap pills that could just be popped anytime, because therapy takes a longer time. You have to do some exercise, you have to do some change your diet and all of that. So instead of that, they offered a very simple kind of formula that you pop some pills and it will take away your symptoms, not your disease. So people, as the industrial revolution started, people thought they don't have time for their own health. They really want to go and work and make money and make a life, so to say. So people conveniently started, popping these pills, and they do that today as well. Unfortunately, people did not see that these pills were not actually curing their illnesses or reversing them, but only making the symptoms go away. And if people stopped taking those pills, the illnesses would come back. And so the person was forced to go and buy these again and again. So this ensured the continuous and ever increasing revenue for these medicine manufacturers as the populations grew. Now, besides that, many medicines cause side effects over longer durations of time, and other organ dysfunctions would slowly start. And then eventually people would not only be taking a medicine for a headache, they would also take a medicine for acidity, or like this is happening even today in the world. You see, my next door neighbor was just taking headache medicines for about 7-8 years with higher and higher dosages. finally both his kidneys failed. And I checked all of his diet and other things, non-smoker, non-drinker. Okay. So this is what I'm talking about. It used to happen then over the last 120 years, and it's got from bad to worse now. So this is what happened over a period of time. People started, paying these allopathic pill manufacturers, and all of the names are the names that we're hearing today. Okay, Pfizer and whether it's Glaxo, all the popular names. Now, I've worked in the facilities of over 25 of the pharmaceutical companies manufacturing units in India, because I was into clean rooms and into biomedical equipment, about this is in 1994 to 96. So I used to look at medicine manufacturing, and I used to design the areas in which these medicines used to be made, and also the air conditioning systems in them. And I used to help my colleagues of the next division install those machines. So I have a very good insight of pharma manufacturing and medicine manufacturing processes. So what happened is over the last 100 120 years, people have just been paying for all of these things, getting from bad to worse, having other organ failures, taking more medicines. And this is how we actually paid into this big pharma, what is called now, and that's how we have made them the $1 trillion industry of the world. But over the last 20, 30, 40 years, as the number of natural medicine practitioners started increasing, then they started helping people learn how to reverse these illnesses, because after a period of time people got fed up of taking pills, because the same illnesses were coming into their children. Because once you have a bad gene set and you follow all this system that does not cure you or repair your genes, you pass on the same genes to the next generation. And so over last 20, 30 years, we have had natural medicine practitioners, whether it is naturopathy, diet or nutrition, herbal detox, acupuncture, acupressure, yoga, or energy healing. Probably over 100,000 of such medicine practitioners have been treating and teaching over 100 million probably people to cure themselves. And this is what I've been doing since the last 16 years, right from 2005. And people today have not understood this important thing. That is, if you were popping pills, for example, diabetes or high BP or cholesterol or infertility, and you started using any of these natural systems. I mean, people who I treated them with an integrated protocol, which involves diet and nutrition, acupressure, organ cleanses, herbs for healing, essential oils, and then another 2-3 systems. One is called the 5 elements therapy. The other one is the natural health therapy, which are protocols that I have developed. Also sun yoga. When I treat people with these, even 3-4 of these components, they start reversing their chronic illnesses within 2-3 months. And this is not just me, it's all of these integrative natural medicine practitioners across the globe. So the fact is that if you were taking these pills for the last 5-6 years, and after doing these natural treatments, and you become medicine free, what is the big understanding? That you did not need that medicine in the first place. The first truth is that it never cured you. So it's not a medicine. The second thing is you are doing without it, and I've been creating medicine free people since the last 16 years. So that is the big shock that people have not understood. Everybody who's popping allopathic pills for these chronic illnesses is operating a fake medicine system, and they believe that these agencies who have conned them over the last 120 years, they believe that they are going to create some remedies for them now. So that's such a misconception. Now this is what I call biggest these were the smaller miracles that I said earlier, of surgery and all of this. What I call the biggest miracle of allopathic pills for chronic illnesses is the current number of comorbid people across the globe. That means all these people who are popping pills right now, their immune systems are so depressed that they are the ones who are the first target of these COVID symptoms, and who are, dying right now of this. Why? It's just because they are living on a life support system and their immunity is so low. So the biggest miracle that I think, which is worldwide, is that's a miracle not for the people. Of course, it's a miracle for big pharma because they have become a $1 trillion industry out of this business model, and these comorbid people are on the receiving side. So I think such people need to look around them. I'm sure in your friends and family, you have seen people who have been cured using diet, nutrition, yoga, and all of these natural therapies. So this is where the common man finds himself today, reading a lot of so-called research that he thinks he knows what is happening. He thinks he knows that, especially people who are popping these pills, they think they are taking medicine and they know about medicine. And no, they don't. And not even their doctors who are giving them these pills. No, they do not know what causes diabetes. They do not know how to treat diabetes and reverse it naturally. So that means such people really don't know the basic immune function and how to operate the human body in a healthy way. And we have these people now talking really and giving big lectures about immunity and about viruses and how they harm you, and giving big lectures on germ versus terrain. If you look at all the, if you listen to all the therapies that I mentioned, whether it's yoga, acupressure, and all, they are all terrain therapies. That means they help the system, the body immunity go higher and higher. Now, even I during this COVID wave, I had these COVID symptoms in May for 1 week, and my 83-year-old mother also had it, but she was more severe. She had it for about 15 days. And but we just treated it at home with liquid diet, with smoothies, with electrolytes, whether it was coconut water or electral, a lot of rest, a simple breathing technique, a little bit of essential oil. There's a lovely oil called Axe, which will open up your breathing system. Then supplements like vitamin C, vitamin B12, vitamin D, zinc. So just natural therapies, even for this so-called biggest, deadly pandemic, it was all treated just operating and helping your immune system work. So right now in countries like India, we have wonderful, results from people using natural medicine, or even if it's the Ayush protocol, or whether it's the homeopathic protocol, or Dr. Biswarup Roy Chowdhury's a nice, treatment. That is the 3-step, similar to the 3-step flu diet for COVID right now, where I think this is an old story that was about 3 months back, that they used to say, 60,000 COVID patients treated in India without a single casualty, just in 4-5 days reversing, their COVID. And I'm sure now, it must have crossed a lakh of people. So this is what we are looking at right now in the world. And I think, the future of health is in integrative natural medicine. And I support, all the emergency treatments. So I call allopathy as the emergency treatment for acute conditions. It is not really medicine for common lifelong chronic illnesses. So it should take its rightful place as complementary emergency treatment and not mainstream medicine. I think the future of health belongs to integrative natural medicine.
Okay, I have a question. So for the panelists, how in the future, how would you all visualize allopathy and holistic medicine coming together? So I'm keeping that open to any panelist. Sure. Dr. Anande?
Yeah. Having worked with allopathy and having worked with drug-resistant TB, and what Darryl was saying about a few days antibiotics or few weeks antibiotic, we have been using antibiotics in drug-resistant TB for a number of years. You know, and MDR TB patients takes antibiotic for minimum 2 years. And that is not one antibiotic, it's a combination of 4, 5, 6 antibiotics. He tolerates all the adverse reactions, whatever are happening, seen terrible things happening to them. So we are not even covering all those patients in the national program with that something Darryl itself told, gut flora, something called the lactobacillus and all those kind of things, formulations, what we should be giving. We are destroying all that. One of the 80% immunity which is built up in the gut, the antibiotics, so many of them they are taking, my God. Now, when it comes to allopathy, I am of a firm opinion now. I mean, the Health Minister of India should take it very seriously. What is this something called allopathy, Ayurveda, homeopathy, naturopathy? Why are all these different pathies? For me, seeing a patient die out there, seeing the relatives' tears out there, I feel we have made it into a caste system with different kind of pathies. Join hands, everybody, come together. Whatever is the best thing for the patients, give it to them. We should not call it allopathy. In fact, we should have a course, probably an MBBS kind of course. After that, post-graduation should be probably Ayurveda, post-graduation, homeopathy, and they should all come from this thing and then go on expanding into their field of excellence. Like we say, somebody is a cardiac surgeon, somebody is a dermatologist, and all this, somebody is a expert in the homeo this thing, Ayur this thing, and they are all good. It's not that they are not good. Somewhere, some pathies score points on one another. That's good. But then we should join hands. What is good at what point of time for the patients, and that should be accepted norm by everybody. No harm should be done to the patient. That's what Hippocrates said. We should not be doing all these kind of things. Instead, treat him as a person, not the lab reports what we got nowadays used to. The bunch of lab reports that comes to a doctor's end, and then so many things that disturb the patient's psyche, that one of my WBC count is somewhat less and somewhat this thing here and there. One of the hairs on my body may be white, and then I go into pursuance of investigating that, not that kind of thing. A friendly way of treating patients, accepting all the pathies so that we can win our war. We are humans. We are fighting against the most intelligent creatures on this planet called microbes. How are you going to fight it? Got to learn so many things from the animal kingdom. Anyway, I think we should join, all the pathies should come together, join hands, because we got to save mankind, the life. Thank you.
Thank you, Dr. Anande.
Yeah, Dr. Anande, I just have a question for you since you mentioned, MBBS course. Do you think that there is a necessity for that course to include a strong subject on nutrition?
Absolutely, there is
See, over these 16 years, I've understood from all my MBBS doctor friends that they got 1 hour lecture, 2 hour lecture, and all of that on nutrition. And even after, so what's going on here? Like you quoted Hippocrates, right? And he said, "Let food be thy medicine, and medicine be thy food." And how could allopathy exclude this topic, in its entire syllabus? What has to be done now with this?
I really write. I shall write very small blogs, and one day something really hit me. I was to write, but I have yet not complete that. And the title of that thing is "मैं किसान क्यों नहीं हुआ." I mean, going into the depth of the illness of tuberculosis and all this thing, I said, I mean, if I had been a farmer, I would have known things better about nutrition to be treated, and we are not doing that. In an MBBS course, whoever is doing MBBS, I told a few doctors, we were just gossiping, and I told them, we should be having 1 year internship, which is there for an MBBS course, a 1 year farming course also, so that we can understand from the heart how much nutrition has the power to cure disease, prevent disease, preventive. In fact, the PSM department, it's a must for them to work in the farmland for 1 or 2 years, and then their degree should be given. I'm not against them. See, only thing is we are missing out on some really, really important topics which can treat patients and prevent diseases. Yeah, Darryl.
Yes, doctor. Yes, appreciate that, and I take your point. मैं किसान क्यों नहीं बना? So very interestingly, I am going to be presenting on. I'm just looking for the date. The food masterclass, which is on the 11th of November. And in that food masterclass, I'm saying some very clear and very strong things. That a nutritionist, a real nutritionist education is only complete when they understand soil biology, how soil biology transfers itself to plant biology, the microbe, the entire microbiome that, keeps our immune system and does our entire digestion, which absorbs all the nutrients and creates our body. So we are created from this. So I'm going to be explaining why the nutritional course should be having this as well, to understand soil biology, how it flows to plant biology, and how that flows to human biology. So I very much appreciate what you just said. Thank you.
Thank you. We have a question from Chandra Vikash. There is increased terrain toxicity due to increasing pollution, air, water, food, noise, light, EMF, and now 5G, leading to prolonged common cold. Should we call it COVID, which presupposes that it is caused by novel virus SARS-CoV-2, and which can be detected by RT-PCR tests and offered protection by COVID vaccines and booster doses? Would anyone like to take that question?
Have a go at it first. Chandra Vikash ji, yes, what is turning out today is, in this modern life, now common man gets an impression that he has just fallen into these habits where he's using chemical body products, and he's eating packaged foods, and he's driving too much of the cars, which is causing pollution, and he begins to think that these are necessary parts of life, without looking at the deeper picture, that these are actually formats of different services for humanity, but they are done by business entities with the prime objective of making profits for themselves, and not caring about the health implications all of these products. So what I would say is that people, this is what I have been doing on my webinars right from this time COVID started last year, when I think it was in May or June that I did my first webinar, where I started educating people to cut out and replace all these toxicities in their life that are suppressing the immune system. I gave an example that you've got 100% of your immunity, but if you're going to eat packaged food products that have got chemicals, artificial chemicals, and synthetic preservatives and stabilizers, that causes internal, they are all oxidants, and they create oxidation as they go through your system, because they are missing electrons, and they start robbing electrons from your digestive tract, causing inflammation is the first stage, which you see mild inflammation with the endoscope. Then it goes into ulceration, tumors, and then cancer. So that is one aspect. So I said that cut out these processed and packaged food products from your daily life and go for fresh and organic, food products. If you're not getting organic, at least eat fresh daily food. So probably about 15 or 20% of your immune system is engaged with mitigating or fighting the effect of these artificial foods. Then besides that, you are using all chemical body products or sanitizers. Say another 15-20% of your immunity is engaged there fighting it. I mean, of course, it comes into your body, and then your blood system and your kidneys and your lungs are all trying to, and your liver is trying to purify all this toxicity and throw it out of your body. And that's the second category. Third is this category what I've talked about, EMFs. All of these unharmonic, unnatural electricities and their fields all around us that are increasing with every passage of 3, 4, 5 years. Now I give the simple example that even at 3G, 10 years back, even at 3G, I would be able to watch movies on my phone, download apps, and do all of this file transfers, and I used to use Napster and whatnot. So even at 3G, internet used to work absolutely fine. So how did it get to 4G and how did it get to 5G? So these are, nobody asked for it. People did not ask for it. These are all business entities who do things for their profit, and they shove, faster 4G and 5G down our throats, saying that you can download a 1 hour movie in 1 minute. I mean, who needs to download a 1 hour movie in 1 minute when you have 1 hour to watch it, live streaming? So it is the common man who now has to wake up and step by step knock off all these toxicities that are being introduced with very clever marketing strategies. They are not really our need. We have to stop buying these things. We have to create medical committees that do the scientific research on all of these things. And right now, 5G is up for research, even 4G. 3, 4 years back, there are court cases which are proving that it causes damage. In fact, in my own society in Mumbai, that's why I left, living on the top floor with all these, cell phone towers on top. People, I started getting headaches and insomnia. Why does there need to be some big scientific research committee to do all of this? People know it themselves. But the problem is these corporates and businessmen, they bribe, they put pressure on the official, mechanism on the government, and whether it's the telecom regulatory authority of India or different telecom companies, there's so much pressure put on these new business systems being forced upon us. So I think the greatest need now is for the education of the common man, so that they reject all these toxic, products in their life. And the second thing is the formation of these committees. I personally was very shocked when, last year when the Prime Minister, when this pandemic became, bigger and bigger, I was shocked that there was no appeal across India to bring in all the wisdom of, Ayurveda, yoga, all, the different healing sciences that we have, and to form a very expert committee of all these different aspects of medicine. If there was some threatening virus that is, coming and killing all of us. But I didn't see that happen. And I was wondering, is this not an effort that, every brain, every great scientist in this country who has done real good for the health of the people, for the immunity of the people, why was such a committee not formed? Instead, we see that kind of committees were formed where today you see that Awaken India movement has issued legal notices to all 24 members of the expert COVID committee at the center for sitting in office of profit. That means that they have got grants and payments from the Bill and Melinda Gates Foundation, from the Global Alliance on Vaccine Immunization, Gavi, and other agencies. So they are passing all of these policies that are promoting this, entire vaccine kind of treatment system. in this country, and I'm sure in other countries too. So I see that as, the problem, that unless people who are knowledgeable and scientists who do independent research and independent work and are not funded by these same businessmen who are, doing all of this, bringing these toxic systems to us, I think that's the only way we are going to have a good future. We need to form new scientific committees. Uh, so isn't it surprising in a country like ours where you have, a lot of this 5G coming and so many common man is doing the research and finding out. Until today in India, there is no expert committee that looks at EMFs and their very detailed damage that is being done to the human body by it.
Do you see these two streams, the allopathic and alternative medicine streams, coming together anytime soon? I know there's a lot of talk about it, but is anything being done?
So I was part of that movement with the World United from 2013 to 2017. Traveling, the metro cities in India every month, a couple of places, and getting doctors, healers, and therapists to work together. Because we would see that there are certain good aspects of allopathy, which we have already covered today, all the emergency medicine, all the diagnostics, and but it was not able to treat all these common chronic illnesses. And from the other side, we could see that integrative natural medicine practitioners, they were able to create, cure these illnesses and teach people how to cure them, but they were not very scientific in their approach and, document based and evidence based, system. So that movement, yes, somehow after 2017, when I left the World United and started doing my own work, I took it ahead, in 2019 with the New Earth Summit. And so we are in the first, 10 days of that. But yes, I think that it's high time right now in our history, especially in India, that we have to start, making these committees and basically bringing together integrative natural medicine practitioners. And we have to handshake. I say this quite often. It's written in my book also, Become Healthy or Extinct, that if there is the most respect that I give to any field of, endeavor and of service, it is actually to medical doctors. Because if you call a medical doctor at 10 o'clock at night or 10:30 at night, he will pick up your phone. But if you call your plumber, your engineer, your architect, or your uh, car mechanic, nobody's going to listen to you. So there's a great commitment from amazing people all across the globe. They set out to do a good job to take care of people's lives. But the problem is that they have been given this system of fake pills, which do not cure. And that is the problem. We need to get that thing out of the way. And we need to bring things such as diet and nutrition, herbs for healing, and so many things that I mentioned as the real medicine. So there are definitely so many doctors that I am in touch with, and every kind of group of such well-intentioned people, they are doing their work across the country, but it's all fragmented. I think a noble cause like this should be taken up by the government of India. I think by the health minister of India, Mansukh Mandavia. I think he should be calling for this, kind of integrative medicine committee to be made. And because if it's not done at the country level, then doesn't that show a lack of interest or a lack of commitment from the higher ups, from the president, prime minister, and all that to the citizens of this country? I was pretty shocked that before I was became part of the World United and was doing this Doctors and Healers Association in 2013. It had already started in 2007 as NADA, New Age Doctors Association. So from 2007 to 2017, 10 years of effort by good individuals, doctors, healers, therapists, okay, was never appreciated by the government. We worked things and we could, it was things that we would give on the platter, but the government never took it up. So that's the real question, and I think it's high time now that you know people have to make the government answerable. Why are the ancient systems of India, the entire Ayush department, why are they being sidelined now during the time of the COVID treatment? When simple things like a three-step flu diet is, curing people, whole of Ayush is so much more powerful. So if I see any future that will move fast ahead to take care of the current crisis, it is only a movement and commitment by the government of India and by the health minister of India to do something concrete and bring all of this together right now. Would like to invite Dr. Bhandary to give his feedback and comments on what I just spoke and what Dr. Lalit Kumar shared.
Yeah, Darryl, there is nothing much to say after you speak. As far as integration and the naturopathy is concerned, I am not only a fan of yours, but one thing I'll tell you regarding my experience and the general public's opinion, they don't care about prevention. For example, if you get allergic reaction after eating egg, the first and the best treatment would be to stop eating egg. That we don't do. We eat egg, suffer from it, and take treatment. And it repeats. And as far as MBBS course is concerned, nutrition is hardly has any role, even now. Not only nutrition or non-allopathic or preventive aspects of 5G or EMF has got very, very little role. There is no detailed knowledge about all those things and the preventive aspects. You remember when the lockdown started, there was hardly any accidents on the road. Of course, you can say there was no traffic at all. So if you drive safely, there won't be many accidents on the road. It's as simple as that. So they say prevention is better than cure. Why don't we start taking importance to nutrition? As you said, you told everything. That has to be the main goal for us, rather than taking medications for years together. Thank you.
Yes, thank you, Dr. Lalit Kumar and Dr. Bhandary. I just want to add one more thing, which I missed saying earlier. And at this I think it's a very critical time in for healthcare, for humanity right now, where we are seeing a very strong move from big pharma to give medicine to every human being on this planet. What I'm saying is the business model has changed. Since the last 20-30 years, as integrative natural medicine practitioners starting teaching people how to cure themselves, so people stop taking, so many people have stopped taking, allopathic medicine. So the income and the profits of all these pharma companies have been dropping. So now it's come to a point where they need more revenue to sustain themselves. So it seems a very opportune time for them to come up with such ideas. Now, for example, a vaccine. Okay, this vaccine has come under emergency use, and that is only when there is no equal or better method of treatment of this current thing that is called COVID symptoms. But like I said, in India, we have so many options. I've done it myself sitting at home. And so many, thousands and millions probably of Indians have done it, right? Uh, so we know that there is an alternative. And that is what is being, proposed to our government. Um, so people have to be very well aware. This is more of a big pharma business move that's happening right now on the planet, of continuing their revenue by just seeing that every human being on the planet gets 4 shots of this injection, and all the technology they're bringing into it, which is called mRNA and spike protein and toxic ingredients in them, and aluminum and graphene oxide and all of that. So so it's only through education and awareness that people have to make the right choices. And like I said, a lot of people are talking now who think they know a lot. But let me say this once again: any person who's on allopathic pills for chronic illnesses right now really needs a lot of education, because they've completely missed of how they got sick and what are the natural ways to heal. Because only when you go in that cycle, that's the only time you understand about immunity and function of the human body. So please, I request everybody to understand more about how to improve your immunity, understand the natural functioning of the body, use natural medicine to cure yourself, because this is the only way how we can stop our DNA that is degenerating with every passing generation. Now, a person may say that I have a lot of money. It's no problem. I can take 5 pills a day. My company insurance, medical insurance covers it. Another person says I've got 3 doctors in the family and 2 surgeons, so I am taken care of. But see what you are doing by continuing to pop these allopathic pills every day. You are degrading the human DNA. And with that degraded DNA, we are making the children of our next generation. That's why we're getting sicker and sicker. And this is a talk I gave at a spiritual, at the first World Parliament on Spirituality in 2012. This is the talk that I gave. Part of my talk contained this, that we have to use natural medicine systems to stop the degeneration of our DNA. Otherwise, humanity doesn't have a future. If this physical body, your vehicle that you call the temple of the divine, that has got higher consciousness coming in, if its DNA and its basic cellular function and endocrine system and its heart, liver, and all of that are not going to operate, humanity actually doesn't have the future. You need to have a healthy body to meditate and to work your chakras and all of that. So this is not a new topic for me. I've been at it since such a long time. But yes, people who have joined the movement have understood, used these sciences, and I say they are the only hope of humanity. So shift from convenience or from not wanting to know, and from lethargy to act, be more active, learn more. Part of our evolution is this. It's not just spiritual evolution. Part of our evolution is learning about your condition and how you can become healthy once again.
Thank you, Darryl. A big thank you to all our panelists and the audience for a wonderful session today. We look forward to seeing you again tomorrow at the same time on the same link for our day 2 topic, which will be In Search of Coronavirus. So goodbye and have a lovely evening. We'll see you tomorrow.